I think of what reform has to accomplish as three things. One is it has to cover everybody, both for moral reasons as well as economic reasons. It's untenable to be in a society where any change in your circumstance, like for example a recession, can mean you're out of the healthcare system. Second is it has to modernize the healthcare system so that we really get money for what we put into it. We really get value for what we put into it. The misconception that you referenced is that the goal is to save money. The goal is not to save money. The goal is to do things where they're appropriate and not do them where they're not appropriate, which is a way of looking at it that's much more consistent with where people are and the values that we have. And then the third thing that we need in reform is we need a public health system that actually works to keep us healthy, to keep us safe, that reinforces our medical care system from things like H1N1 flu, to avian flu, to food and water safety, to obesity and smoking cessation. What people need to understand about healthcare reform is that we can improve the quality of care and lower spending at the same time. Think about those patients with chronic disease who are not getting treated appropriately. Treat them more appropriately, they don't go into the hospital, they spend less, and their quality of life, their length of life is increased. That's what we can do if we really do it right. So yes, we need to save money, but we will save money as a byproduct of having a system that works better. We're not going to save money by taking a meat axe and just clawing off some part of healthcare spending. That's what a lot of the alternative is. If we don't do this, what's going to happen? Probably a lot of employers will just say, hey, you know what? We're just going to stick you in a health plan with very high cost sharing. You go out and deal with it. Everything we know is that people will stop taking their medications, they'll save money, and their health will deteriorate. We have to find a way, and we believe there are ways, where we can save money and we can improve health. And people know this. People know that the healthcare system costs more than it should, and a part of that is because the thing just doesn't work right, and you wind up having people in very expensive circumstances after the fact when you could have prevented it. So I don't think that convincing people of that presumption is that hard. I think what we have to do is, one, make sure we do that, make sure we put the steps in place to do that. And second is we need to make sure we don't demagogue it. So we just say to people, oh, well, what the president wants is to ration your care. Or what Senator Kennedy wants is to make sure you don't get stuff. We need to get away from that because people it's complicated enough. No one's going to understand all the details. And if people hear those things and they get scared, then they'll be tempted to back off. And that would be just the worst of all situations.